And right now, we are going to be talking about visual or vision rehabilitation, as we have already seen in that feature. And we have a guest here with us to educate us and tell us about everything we need to know, or answer all your questions that you may have on vision rehabilitation. Let Modupe do the honors.
Yes, of course. And with us on the show today, we have Dr. Yemisi Soyombo, and she is a clinical optometrist. You're welcome to the show.
Thank you.
You're
for
welcome.
having me. Thank you. Visual rehabilitation comprises of different methods and different specialties to help people who have lost their vision regain some kind of functional size, or will I say, get back on track, maintain the little vision they have left, and maximize it in quotes, you know, and still have a functional life, nevertheless. Yeah.
All right.
Okay, so now we know about regular eye care, going to the optometrist, and we also hear about vision rehabilitation. Can you outline the difference for us?
The optometrist is your primary care provider. If need be, you're referred to an ophthalmologist. However, for visual rehabilitation, the eye doctors or the eye care professionals are not the only ones that provide the services. And this is because it's a range of services. There's a part that the medical visual specialists would have to come in. There's also a part for counseling. There's also a part for learning how to be independent again after significant visual loss. Different specialties, different professionals play in getting someone to maximize whatever vision is left after a visual loss or whatever must have cost it.
Okay, so basically vision rehabilitation is a package.
Yeah,
it's
a package.
not just
That's
right.
the word.
Okay,
Yeah,
so like we go to the regular optometrist for like to check our eyes, but for rehabilitation it's a whole package.
So now you've defined what visual rehabilitation is, and let's go to what causes it actually. Why is it necessary as a point?
Necessary? There are a couple of things that would happen. There are a couple of diagnoses that will lead to having to advise the patient to say, you know what, you have to go for rehabilitation. Glaucoma, especially if it wasn't managed on time, and then it has led to a high degree of visual loss. Diabetic retinopathy or diabetes in itself, visual loss, or will I say diabetic retinopathy, a group of things that happen in the eye due to unmanaged diabetes. It's part of the complications of diabetes. So sometimes visual loss, comprising of so many other things happening in, can also, is one of the complications of diabetes. Sometimes injury, you know, blunt injury to the eye or a head injury. A complicated head injury can also lead to visual loss. Cataracts, although cataract has a cure in that it can be surgically taken out. However, sometimes when it wasn't managed properly, when the patient didn't go to seek help in time, it could also lead to visual loss. So it's when the visual loss occurs to a certain degree, and where glasses or optical aids cannot help, that's where we begin to talk about visual rehabilitation.
At what point do you know that it has gotten to the point where you need visual rehabilitation from regular eye care? At what point do I know that, okay, my eye hurts, I have a certain problem, but this has passed, you know, getting my glasses and eye drops, and this is at the point where I need visual rehabilitation?
Yeah, that's a good question, because a lot of people don't even know that it exists. A lot of people don't even know where to go to in the first place. But it still goes back to being conscious of our health, being conscious of our sight. We all advise annual eye checks based on certain criteria and ages. However, the first point of call is to go to your eye care practitioner, you know, the ophthalmologist, the optometrist, and if need be, they will always refer you to the process of going through a visual rehabilitation. But it's good to know that it exists. It's good to know that the fact that I've lost my sight or functional sight is not the end of the world. It's good to know that there are a lot of even technology assistance to help regain functional life, even with your sight. Yeah.
Okay, I know that we have the visual rehabilitation therapist.
Yeah.
That's a lot to take. Visual rehabilitation therapist. And so what is their duty? What do they do?
So the therapist, first of all, evaluates your life,
Yes.
the lifestyle at that point in time. In fact, to regress a little bit, research says that after age 60, 1 in 4 people would have visual needs, or some form of visual illness or the other. So the therapist looks at that person or that patient.
Yes.
Sometimes, it's not a rule of thumb. So some people might not even have gotten to age 60. Remember, I talked about the things that would have cost it in the first place. So it's not all of them are synonymous with what the person's age was. So he looks at your lifestyle, they have a couple of tests that they also would do, and then they determine what kind of aids would help you at that point in time. Sometimes it might be optical aids, sometimes it might be non-optical aids. Non-optical aids like some kind of lighting source, some kind of TV source, that gets things more enlarged. Sometimes they have to counsel, like I said. Sometimes they have to teach you other skills. When the loss of sight could be psychologically demeaning as well. It affects people psychologically. So sometimes we are looking at letting the person get all the skills for everyday life, how to walk to the door, how to pick up a cup again, how can I read, do I need more lighting source, do I need another kind of aids to put on to help me see, can I cope with some kind of aids as compared to the other. So, this specialist looks at this in a whole, So, like I said, it's not just all about, let's do an eye test. Can you see, can you not see at this point in time? There are a whole lot of other things that
involved
are coming to play when you talk about the visual rehabilitation. Yeah.
Okay, so at the point where you realize and decide that you need visual rehabilitation, how long does it take to not need it anymore, to get to a point where you're, back to your functioning state?
Unfortunately, most often than not, it's long term. It's long term because vision that is lost 90% of the time cannot be gained back. So the role of the vision specialist or the role of the rehabilitation specialist at that point in time is, let's go steps from here. This has happened. How can we maximize your sight? How can we get you back to live maximum comfortable life? What are the assistance you will need? So unfortunately, most often than not, I can't authoritatively say that you get your vision back after a while. It's more like an aid that you might need to use long term.
So it doesn't get really, really bad.
Yes, so that it doesn't get worse, and not just even getting worse, so that you can live comfortably again. You can get maximum productivity, even though some amount of vision is lost. There are also some aids for even driving, for people who have lost their vision and still have to drive. Right. If you qualify for some certain aids after you have been examined, you can still have some aids that would help you drive. There's some aids after the low vision specialist has examined you to help you read as well, so that you're not dependent on someone to read, you're not dependent on someone to drive. It's a whole lot. It's a whole lot. And we cannot throw away the psychological effects of someone losing their vision. Some people get depressed. Imagine having to be dependent all of a sudden just because your sight has deteriorated and there's seemingly nothing the primary care or surgery can do afterwards, So sometimes, even after the surgery has been done,
you still have to
go and see how you can maximize whatever percentage of vision is left.
Okay, so let's talk about the rehabilitation process. What are the methods? How the therapist, how does he go about it?
So they have, the therapists have criteria for, what's it called now? I want to use the word testing, and I don't want to use the word testing. But on a general base, there are different equipments, there are different, will I call them assisted objects. Some are optical, like I said earlier. Optical meaning special kind of glasses. So not the regular glasses that you have seen with the patients that we all see every day. These ones are specially made. Some are special lighting source, you know, because at that point, some patients would need light, a lot of light. So on the general, so I don't bore you, the visual requirement of a patient determines what device, whether optical, non-optical, or a combination would be given to that patient.
Oh, sorry, I was waiting to hear where brailles will come in.
Yeah.
Is it part of the rehabilitation process?
It's also part, and it's very helpful, especially for people who have lost sight almost completely. You know, so they have to learn the brailles all over again and have to use it to read. And surprisingly or positively, they get back on track. They get to read, they get to study again. Some have even gone to get further education to PhD levels. So I mean, that's also a very, very, very useful technique. Some people also have to learn new skills as regards new work, as regards new hobbies, as compared to what they were used to or what they used to love.
Okay, so let's talk about the affordability. How affordable is visual rehabilitation? And if it is very expensive, how does one go about getting this care, even regardless of the fact that it's expensive?
So in a lot of other climes, some of these things can be subsidized. Of a truth, if you try to get a lot of these aids in the private sector, it's expensive. Yes, it's true. It can be very, very pricey. However, I'm aware that there are a lot of also government setups that you can go to and get it a bit more affordable than walking into a private setting. However, the timing, the numbers, the crowd, the wait is also a factor to consider. However, the government hospitals, a couple of teaching hospitals, I know there's a very functional low vision center in Lagos here as well. And if need be, we all refer our patients to the low vision center, and they usually get help.
It's good to know that the government is making provisions.
Yes.
Some people would hear about vision rehabilitation and feel like, oh, that would definitely be pricey, so I can't afford that. Let me
a lot of times they're pricey.
It's actually good to hear.
And I would like to talk about technology as well. So there are a lot of technology innovations. I was even sent a read up on a new one recently that actually does help patients who are diagnosed as completely blind. And it's technology, they can put it on like a VR machine and they can still get to see. So there are a lot of other technology.
For people who are completely blind.
People who are completely blind. I'd love to mention the name of the product, but I mean, for for where we are at this point. But there are a couple of technology innovations coming up every day that are available, that you can buy in the market. And if you can go to your low vision specialist or be referred to your low vision specialist, they would definitely advise you. However, it might be pricey.
I was being
most of the time it's pricey, but it's available. We need to know that these things are available.
Thank you so much for coming on the show.
I'm happy to be here.
Us and educating us.
Thank you so much. Because I actually learned a lot.